Still with that story, there are also concerns in the report about the number of young women and teenagers who are infected with HIV. In the 15 to 19 age category, the 20 to 24 and 25 to 29 age groups, women and girls account for the higher number compared to their male counterparts. Let's discuss this further then with Professor Khangelani Zuma, Executive Director at the Human Sciences Research Council. A very good evening to you, Professor. Good to have your time. So, how should we be interpreting this HIV data, especially as relates to the youth overall and young women in particular?
Thank you very much for the opportunity. We should be looking at these numbers as an indication that we are doing something right. We are making a dent in the fight against HIV epidemic. But this should not be seen as a time whereby we can now sit back and say we've done what we needed to do. We are not there yet. We're still far from that point, especially if you look, as you've just said, among young people. The HIV still continues to be a problem in the sense that the youth is found to be less likely to be virally suppressed. So the amount of virus among youth is much higher than what we see in the general population. And one of the biggest contributing factors to that is the fact that a number of them do not know their HIV status. They are not on treatment and therefore not virally suppressed, because the numbers show that once people are on treatment, the levels of viral suppression go very high and therefore reducing the transmission of HIV.
But from the study, it said that 90% of the young people, this is the category age 15 and older, are aware of their status. 91 of those aware are on antiretroviral treatment. And what you're talking about now, being virally suppressed, also quite important. So that is some good news, right? But how do we then make up for that 10% or so who are not covered?
Indeed, it is some good news, and the statistics that are provided are for the 15 years and above. Overall, we are making progress, but we still need to do a lot more to get people to be tested, so that as that is the entry point to treatment. So we need to encourage people to get to the facilities, get tested, know your HIV status, get to be linked to treatment, because it is the way that we can reduce population viral load, so that as we know that we use the phrase that U equals U, meaning that if your viral load is undetectable, then it is also untransmittable. So therefore, the more people we get into treatment, and the entry point being knowing one's HIV status, the better. So that is how we need to get those other 10% that do not know their HIV status, and therefore also they are not part of the treatment pool.
And a lot of us may, from our privileged positions, take for granted and in fact assume that there is easier access to information now in terms of safe sexual and reproductive health, HIV awareness, etc. But is that the reality for all South Africans? I mean, we were talking in the office today, just listening to the briefing, about how growing up, for example, there were television programs such as Soul City, Pamgade, etc., who actually dealt with the subject matter and how people who had been diagnosed could be treated, and how even those around them were encouraged to behave and respond.
I think we have regressed. We have regressed. If you look, for example, if you drive, for example, going to work, I don't know when was the last time you saw a billboard about HIV and AIDS, educating people about HIV. It's something that you hardly see around. And also, if you look at the statistics about condom use, the levels of condom use are very low. As the numbers show, around 50%, especially of youth, that reported multiple sexual partners also reported condom use, which is very low, especially because it's among those that reported multiple sexual partnerships. And if you look back the statistics from 2010 up to now, the proportions of people reporting condom use at their last sexual encounter, actually the numbers are going down. And you wonder whether our visitors during the 2010, they left with all the condoms in the country because condom use has gone down. And that is why we continue to have a pool of people that will continue contributing to HIV epidemic unless we deal with these problems of multiple sexual partnership, ensuring that everyone gets to know his or her HIV status and they are put on treatment. We'll have this gap that we need to deal with and get to be enrolled on HIV treatment.
And why has condom use come down? Why has the level of condom use declined?
I think it's the education on behavioral information, promotion of condom use, promotion of safe sexual behavior. That is what we need. That is what we need to encourage, continuously educating people that we still have a problem of HIV. And also, for example, if you look at the statistics, the HIV prevalence among young girls, 15 to 24 years, is comparable to HIV prevalence among men that are 10 years older than them. So which is a clear indication that we have a problem of intergenerational sex. Older males having sexual contact with young girls.
Is that
continues to...
Is that the same thing as sexual exploitation of young girls by older men? Because, for example, in the school system, one of the main concerns is around male teachers who basically rape or take advantage of teenagers for their own benefit in exchange for money, sometimes in the poorer communities or otherwise because of their own sordid desires, if you will.
Yeah. The challenge is that once there are these big gaps in age between these male partners and their female partners, there are those power dynamics. Negotiations of safe sex, condom use become a problem. So those power dynamics, they will play a role in this situation, and they contribute to higher infections, especially among young girls. And then at a later stage, you'll find that those girls who have been infected at young age, they will get married to young boys or men within their same age group who most likely will be HIV negative. Then they become infected. And that is why at a later stage, you see most of these males now, HIV infection among males, catching up the infections among females. But among younger age group, it's females that are much higher than males. So that is what we also need to deal with.
How concerning is it, though, that at the moment, government, we know, is talking a lot about cuts in budgets, and among those will be a cut in the spending on HIV/AIDS programs within the health department. How big of a setback does that present?
That will cause problems. And I would say, if you're looking at the numbers, we are not at the time where we should actually be cutting. In fact, at this time, we should be investing even more, because otherwise, until we have wiped out the epidemic, if we do not do more than we've been doing, we will actually have a situation whereby we are dealing with the HIV epidemic, but we've got a pool that we sustain. And therefore, in the long run, we will have to spend a lot more to actually eventually wipe out the epidemic if we do not invest more now. So I would never suggest that we should cut on the budget. I mean, if you look at condom use, as we're talking, for example, now, is very low. HIV infection, the prevalence has gone down. But remember, the prevalence is a function of a number of factors. More people being on treatment and also more babies being born HIV negative, so that's the population growth. But you still have new infections that are coming in. And also, if not everyone is on ARVs, you still have a pool of people that actually is more likely to transmit the virus at any time when they are exposed to unprotected sexual intercourse. So we shouldn't be cutting down on the budget for these interventions.
And just on the issue of prevalence, as we conclude, I was looking at the provincial breakdown. You've got the lowest level of prevalence in the Western Cape, if I'm right, it's at 8%. And then, more worryingly, in KwaZulu-Natal, it's more than double that figure, 22%. What's going on in KZN specifically? In
fact, the way we should be looking at is KwaZulu-Natal has got the largest number of people living with HIV, but also has got the largest number of people being on ARVs, and also the largest number in terms of the highest proportion of people that are virally suppressed. As you know, for a number of years, KwaZulu-Natal has been leading, unfortunately, in the numbers of people living with HIV. But this time around, KwaZulu-Natal is leading mostly because these people in KwaZulu-Natal who have been HIV positive, now most of them are on treatment and they are living longer. And the graph is showing, although it's for the population, but the graph is showing a nice trend that shows an aging HIV epidemic. So it's not that of a bad statistics because it indicates that people are actually living longer on ARVs now.
Good to speak to you. Professor Khangelani Zuma, Executive Director at the Human Sciences Research Council. Really good to have your time. Thank you.
You're most welcome. Thank you.